Hi everybody, Michael Jacobs here at the Fertility and IVF Center in Miami. Welcome to this Instagram Live event. Today we're going to talk a little about navigating IVF and fertility treatments in the new normal. With COVID-19, obviously a lot has changed, but there's a lot that's not changed. And the basic part of life that's not changed is, as many of you know, the desire to have and expand a family is pretty much the same. Couples are still infertile. It's the unusual couple that's managed to get pregnant over the last 2 months. So people want to have families, they want to have treatment. And from our standpoint, the need for proper medical evaluation and management is the same. And the need for directed treatment resulting from evidence-based medicine giving us the best results is also the same. From a practical side, we still need to evaluate couples. On the female side, it means usually testing for ovarian reserve. Do you make good eggs? Are the tubes and ovaries normal? And is ovulation taking place? On the male side, it's a little simpler. We just check a semen analysis. We check sperm count, motility, morphology, and make sure the sperm is competent and capable of fertilizing eggs based on those numbers. On both members of the couple, blood tests are necessary to screen for infectious diseases, thyroid, prolactin hormones, blood sugars, chemistry panels, as well as preconceptual genetic screening to make sure that neither member of the couple is carrying a gene that would affect a future pregnancy. So these things still have to get done. They just have to get done in a more unusual way, sometimes because of the issues of accessing health care, particularly with stay-at-home orders somewhat still in place. Fertility treatment options, for the most part, fall into a combination of using ovulatory drugs and combining them with intrauterine insemination or doing IVF. And as many of you know, IVF is a multi-step process. It involves first stimulating the ovary to produce eggs, being able to harvest those eggs in an office setting under sedative anesthesia, taking the eggs, fertilizing it with sperm, and then growing the embryos to the 5th or 6th day of development. At the 5th or 6th day of development, when the embryo is at what's called the blastocyst stage, we have the ability to either transfer the embryo or to biopsy it for genetic testing and cryopreserve the embryos. And so what has changed in this, and how do we accomplish this in the new normal? What's changed is obviously the presence of coronavirus and how this has affected access to health care, and how do we keep both patients safe, your potential pregnancy safe, and our office staff safe as well. As you know, our centers stopped doing procedures for about 6 weeks to try and mitigate the risk factors and to benefit both patients and physicians and healthcare systems to minimize the chances of infection and to minimize the load on sick patients coming to ICUs and stuff. In the Baptist health system, the peak of COVID was last month, and at this point our program is operational. We're pleased to announce that we're able to start patients in cycle, and we plan to do this in a safe and an effective manner. The new normal involves minimizing risks, and from the good news for everybody is that all of the basic medical societies, for the American Society of Reproductive Medicine, the American College of OBGYN, none of these societies have recommended patients not get pregnant. But obviously, their patients have concerns about pregnancy with COVID-19 being in the community. And so what issues do we need to think about in getting pregnant? the good news is that we can provide services in a safe manner, and the bad news is that we have more questions than answers. And we're optimistic that down the road, treatment for COVID will be more medically based, and that a vaccine will be available, and we'll kind of go back to the way things have always been. But in the short run, we need to just have patients be aware of what risks are there. Should I get pregnant now in the first place? And the answer to that is individual for the patient. You need to live your life in a way to minimize the risk of infection because of all the unknown questions that we'll go over. And, the concerns of being a pregnant patient are just you're carrying a pregnancy. In a late pregnancy at 8 or 9 months, you've got this big abdomen pushing up on your lungs, basically. And whether it's COVID or any other respiratory illness, obviously that's a compromised situation. The other major question is, what about the effect on the baby? And this is still not known with certainty. The initial data that came out of China suggested that there probably was not a vertical transmission, meaning from mother to baby, but this is not 100% known. And the concerns of does exposure to COVID cause miscarriage or fetal demise or birth defects is really not known, because it hasn't been around long enough for us to know the results from all this, because up until 5 months ago, this didn't exist. So a lot of the questions, a lot of preliminary, somewhat reassuring data, but not a lot of answers yet. And so these are just things that we'll have answers as time goes on, but don't have answers immediately. So what are we doing to try and minimize people having problems during this time period, and to make sure you have a safe baby and a safe pregnancy? A lot you need to do is follow the recommendations of the CDC, obviously, safe distancing. The good part of our office is we're on the first floor of the Medical Arts Building at Baptist Hospital. You don't need elevators. You walk in on the first floor, you come into our office. We're limiting the amount of patients in the office at any one time. We're keeping people separated as best possible to keep social distancing as best we can. And certainly we recommend, from a safety standpoint, to home quarantine as best possible to just minimize the risk of exposure in general. We ask patients that are coming to the office to come alone or with one adult partner if need be. We're happy to use FaceTime or just regular cell phones to bring your partner into the conversation or exam room or ultrasound that we're doing. And we ask everybody to wear a face mask, obviously. We want patients to feel comfortable coming to our office, that we are watching for their health and trying to minimize any medical issues in general, as well as any effect on a pregnancy. When patients come to the office, the building will usually ask them a couple of questions before they even get into our medical arts building, as well as take a temperature to make sure there's no evidence of recent infection. And we do this, and that's for our staff or anybody entering the building as well. So our staff, the doctors, everybody goes through the same screening process as our patients to make sure that that people are as healthy as possible. In looking for testing for COVID, is this routine or not routine? Patients who are coming for, if you have symptoms of COVID, an unknown respiratory infection, temperature, loss of smell, any of any of these symptoms, you need to not come to the office. You need to notify your physician and get checked out. If everything's fine, coming into the office is fine. We don't do routine testing for COVID in our office. Antibody testing that you're hearing a lot about right now is very good from a public health standpoint. If patients want to be tested, we can order it for them. It's not a big problem for us. But it only tells you if you have a positive antibody test, more than likely you've been exposed to a coronavirus. It doesn't specifically mean it's COVID-19, although the other coronaviruses aren't that common in the United States. And a negative test doesn't necessarily mean you're negative. A nasal swab test is what's done right now to see if there's active infection. If you think you have active infection, you shouldn't be coming to our office. But we do recommend and insist that nasal swab testing be performed in those patients who are having in vitro fertilization. If you're harboring a virus that could potentially cause a very severe respiratory problem, you don't want to have sedation in order to have an egg retrieval. And also, we don't want you infecting anybody else or us infecting you. So nasal swabs will be required for patients undergoing IVF, both prior to starting fertility drugs, as well as about 4 or 5 days prior to the anticipated egg retrieval, so that we can minimize your health and safety as well. As we said, pregnancy as a whole produces more questions than we have answers. We're finding most of our patients very anxious to get started in treatment and want to get started at this point. There are some patients that are hesitant to get pregnant just either from the stress of COVID in the community or their fear of being infected without knowing how safe it is. And, if you feel that it's not the right time for you to get pregnant right now, then we get into a discussion of what do we need to do to try and preserve your fertility. And, if you're 23 years old and have good ovarian reserve, delaying a year is probably not going to make a big difference one way or the other, unless there are other circumstances to say, no, I want to have a baby right now. If you're 42, time isn't on your side, and delaying is not really in your best interest. And so even in patients, we recommend patients as a whole consider fertility preservation when they get to 30. Once you get in your mid-30s and you have a good ovarian reserve, you want to use that to your advantage to maximize your fertility potential. And if it's not the right time to have a child right now because you don't have a partner and you don't want to be a single mom, but you want to preserve your fertility for down the road, or you have a partner, you want to maximize your fertility for the future, but at this moment in time, you're just not comfortable for whatever reason, whether it's COVID or anything else, the big advantage that we have is that we have the ability to both cryopreserve eggs or cryopreserve embryos, if a male partner is available, to basically preserve your fertility. And that's done by doing the in vitro fertilization. If we're freezing eggs, you're on fertility drugs for about 10 days, and then the eggs are aspirated, but instead of being fertilized, they're just frozen and stored away for future use. If you have a partner, then we prefer to freeze embryos. And so it's the same basic process. You're stimulated with fertility drugs to produce eggs. The eggs are fertilized in a dish. We let the embryos develop for 5 to 6 days. At that point, the big benefit is the ability to potentially do pre-implantation genetic testing where the cells on the outside of the embryo can be biopsied, and we can learn the genetic competency of that embryo. The advantage of that, if you're storing embryos for future use is at least you can have the reassurance that the embryos that you're storing are genetically competent and potentially can implant into a uterus and result in a healthy baby down the road. So preserving fertility is an alternative for patients that are uncomfortable proceeding at this point in time with pregnancy. Most patients want to have a baby now and get going, and if we're putting embryos back into people, which we are up and running and doing, here you just have to be smart. It's stay at home and minimize your contacts with potential people that might be infected and you just don't know it. So it's what we've been doing to keep you safe. It's what you've been doing to help first responders stay safe and to help the people who really need severe hospital care. If you're pregnant, you just have to go a little bit extra and protect yourself and the pregnancy by just minimizing your risk of contact. And that's pretty much the new normal. We're here to take care of people. We can do it in a safe manner. We're going to do our best to keep you safe, to have a healthy pregnancy, to help you make a baby, to have your dreams come true, and for us to be here to help make that happen for you. If now is the time to have a baby, we're here to take care of you. If now is the time to preserve your fertility and you feel more comfortable delaying getting the embryo transferred now, that's not a problem. These embryos can stay frozen for years. So just let us know when you're ready to get started. We're happy. We're up and running. Our program is fully functioning at this point. The staff is the same. The doctors are the same. We're here to take care of you and help you have a happy pregnancy. As far as is Baptist open for elective surgery, one of the questions basically, not yet. Surgical Park Center is available for elective surgery. Baptist has not yet opened up their scheduling department. They anticipate late May or early June, but they haven't given us a definite date yet. And they have asked us not to schedule anybody yet until they formally open it up. They do require testing for COVID prior to anesthesia. Recommendations for trying to stay COVID-free after implantation. I think home quarantine is as good as you're going to get. The best thing is to have contact with as few people as possible. You have your own nuclear family, whether this is just you and your partner. I know people that have sort of expanded nuclear families where they have really good friends that they want to be able to associate with on a regular basis, and they've made a commitment to each other to minimize their exposure during the stay-at-home period. But even once the stay-at-home is lifted in South Florida, I would recommend that functioning in that same mentality is probably to one's advantage. And if one's going back to work, you have to assess what work environment you're in and does it provide a really big risk or a little risk, and you just need to do things to minimize the risk as best possible. If anybody is calling the office, you'll get a call back usually the same day or next day, and we're ready to get people. We're getting people in cycle and coordinated. For IVF, the question is how many COVID tests do you need to have? We do one prior to starting fertility drugs, usually about a week before starting the injections, And the big benefit of that one is for you to feel safe, and that you're not going to start a lot of these expensive medications only to have a cycle canceled. If you come back positive, we have to cancel you. So we like to do one before you start any injectable medications, and then there's a second one that's done 4 to 5 days prior to the anticipated date of egg retrieval. As far as the differences between frozen and fresh embryos at the time of implantation, in our program, the success rates are relatively similar. We do better with the frozens because they've been genetically tested and found to be competent, so there's less miscarriage rates associated with them. But embryos that are frozen do pretty good. 98% of them freeze and thaw fine, and it's very rare for us to have an embryo that doesn't survive the process. Supplementations prior to treatment. In general, as a minimalist, a multivitamin. In patients with diminished ovarian reserve, we recommend often additional vitamin supplements such as CoQ10, DHEA, and L-arginine. And we'll provide you a little book on vitamin supplements. Not a lot about, there's limited data and very few well-controlled studies. But in women with diminished ovarian reserve, sometimes it's healthful. The risks of COVID after transfer. Do you need a COVID test prior to transfer? No, we don't do another one prior to transfer. If you have any symptoms, we can certainly recommend please don't come to the office, get tested. But there's no real good test we can do. As far as, even if we do a COVID test to see if you have active infection, you could test, there are false positives and false negatives with the test. You could theoretically contact an infection, in between the period of when the test was done, and that's why we ask people to home quarantine from when they get tested prior to getting their eggs and embryos. If somebody wants to be tested, we're happy to test them. And if they want to be antibody tested, we can order those tests. A positive test is reassuring. A negative test for antibodies doesn't really tell you anything one way or the other. We just, if you're concerned, there's no test we can do unless you think you were exposed to COVID, and if you have antibodies, that's probably better than if you don't have antibodies. But even the antibody tests right now, how high a value you have and how does it correlate with so-called immunity is not known. When you do the test, it just comes back positive, negative. It doesn't tell you you're immune or not. Nobody knows how long these antibodies stay around. So again, a lot more questions than answers. But if somebody wants to be tested for an antibody, we can do that, order that test for them. But we don't do the nasal swab as a routine before frozen embryo transfer. Swab tests, 3 days to get the results back, and that's why we have to do them 4 or 5 days before the egg retrieval to make sure we have the result prior to anesthesia giving sedation. It's a question on first embryo transfer failed and natural killer cells being elevated. What do we recommend to have a positive pregnancy? If you have elevated natural killer cells, the concern is whether that part of the immune system is being a little overreactive and reacting with a embryo and not having it continue to develop as well. So we usually recommend intralipids, which is a form of nutritional therapy actually, where a dilute solution of a fat emulsion can be infused intravenously 7 to 10 days prior to the transfer. that seems to suppress the natural killer cell response. Prior to surgery, it has to be within 3 days of the date of surgery, and that's coordinated with Baptist. It's coordinated through Baptist's testing system. If the surgery is being scheduled through Surgical Park Center, their facility does not require a COVID test. So it depends on where it's scheduled as to what the requirement is. Some of these requirements are going to change. This is an influx thing based on recommendations, based on the prevalence of the COVID infections in Florida. And so a lot of these recommendations, you have to realize, may change week by week or month by month. But at present, at Baptist, a antigen swab is required prior to surgery. At Surgical Park Center, it is not, to my understanding. I think I already addressed the issue of is now a good time to get pregnant. I think it's fine to get pregnant as long as you use common sense. You've got to be a little extra careful and make sure I wouldn't go to bars when they open up. I wouldn't congregate where there are a lot of people around. I certainly would not go to a football game or a baseball game as much as I enjoy sports. So you just have to be more careful than you might normally. If you're not comfortable with that, then I highly recommend doing IVF and cryopreserving embryos for future use. Question of how is the nasal swab done? It's taking a swab, which is basically, think of it as a long Q-tip, where you've got a little cotton end of the Q-tip, but instead of the Q-tip being 3 inches long, it's about 6 inches long, and then in the nasal cavity, it's swabbed into each nasal passageway, and it's left there for about 5 seconds. And you do one side, take it out, do the other side, take it out. It's then put in a viral transport media and sent to a lab for evaluation. It's a little bit uncomfortable because you have this Q-tip being put into your nose, but it's over very quickly, and having had it done myself, it's not anything that's intolerable. It's 10 seconds of discomfort, and that's it. There was a question of how good or bad am I with an AMH of 1 at 36 years old. An AMH of 1 is low, pretty much at any age. It suggests that there's less number of good quality eggs in the ovary, so the quantity and the quality of the eggs that are in the ovary are not as good, and certainly it's a time to get pregnant. If you don't want to get pregnant right now, then freezing eggs or freezing embryos is something that you should consider. AMH and ovarian reserve tends to go down as you get older. It doesn't get better. So, sooner is better than later. Being more aggressive is better than less aggressive if one has diminished ovarian reserve. As far as where to schedule surgeries, that depends on what's available to schedule it, your insurance issues, if they cover one hospital or the other, and our ability to get operating time. The swab tests for our IVF patients are being done by our office. We're scheduling them. The ones prior to treatment are scheduled once or twice a week, and that we actually do by a drive-by, where we'll coordinate a time in the morning and ask you to drive by the front of the office building. We'll come out and do the swab. It requires us as providers to have protective, PPE. We have to have a mask, a face shield, and a full gown to protect the person doing the swab. And so the swabs are done by our office for the people in IVF. If you just want to be screened, we don't have enough swabs available to do that. And for that, I would contact, Baptist or, community health facilities to see where they have the community drive-through for routine testing. But we will do the patients who are in IVF in our office. We have enough swabs and access to the tests for those limited number of patients. There's a question on whether hysteroscopy is a routine procedure before embryo transfer. An evaluation of the interior of the uterus, an evaluation of the inside of the uterus is necessary before an embryo transfer. We prefer hysteroscopy because we're able to do it with a very tiny 3 millimeter diameter flexible telescope that we can do in an office setting. It doesn't require any anesthesia. It doesn't cause much discomfort, and we can have a look directly in the cavity to see if there's anything anatomic that would prevent an embryo from developing. The other options are saline infusion sonogram or hysterosalpingogram. In that case, it'll tell you if there's something there or not, but it won't tell you what it is, and that's why we prefer hysteroscopy, because you're directly looking at what's there rather than a filling defect that says there's something there. But you do need some form of uterine cavity assessment prior to an embryo transfer. Usually, if this test has been done within a year, that's okay. If there's any concerns due to intervening history, then we may want one done sooner than that. IVF, there's a question of can tests be done elsewhere for those patients that are far away from Miami? The answer is yes, depending on which tests they are. Routine blood tests, not a problem. We can coordinate that with commercial labs or a physician nearby. If you're going to do nasal swab for COVID prior to starting fertility drugs, we're fine with that in wherever community you're at, as long as we have the results before you start the injectable medications. The test that's done prior to anesthesia we have to do in our office because we have a time limitation on that one. We need to send it to the lab where we know we're going to get a result back within a couple of days. As far as is Florida lifting restrictions too early, I think that we're being a little more conservative in Dade and Broward, Monroe counties. Our decision to starting patients back in cycle was based on the peak in our area actually occurring in early April rather than in May. And, I think, again, if you're going through treatment, then you need to just be extra careful. You just need to use common sense and do things to minimize the risk of being infected. And there's another question on natural killer cells and whether that improved pregnancy outcome. The data on that is very controversial. Some people don't test natural killer cells. We do if there's a history of recurrent implantation failure or miscarriage. When we looked at our data with our patients, we seem to have an improvement, but there's a lot of controversy on that treatment. The treatment is not overly expensive. It's not overly invasive. It has minimal risk of side effects when done properly, and it has potential benefits. So in this particular area, we recommend considering treatment if that's the only abnormality, if that's the abnormality that's present. A frozen embryo transfer is allowed by ASRM. The guidelines of ASRM, which came out on April 27th, were much more relaxed from the previous ones in early March. It basically recommends that each individual center within their community decide what's appropriate for their community. It is recommended to have the discussion that we had a little bit earlier in this Instagram, and looking at, what concerns you have and what risks are out there. And again, it's not totally known. Does COVID cross the placenta? Does it affect the baby? Does it cause miscarriages? Does it cause birth defects? Does it make the mother more susceptible for infection? Is there some protective aspects of pregnancy on the other hand? And a lot of this just is not known. So it's a matter of discussing this individually with myself. If I'm your physician, if one of my partners is taking care of you, please talk to them about it. We're pretty open about what we know and what we don't know. We'll be honest with you, we'll be transparent with you, but we may not have all the answers for you because they don't exist yet. There's a question of false negative and positive tests with swabs. This is a problem based on the amount of viral load and what kind of test is being performed, and the benefit for IVF patients of being tested ahead of time prior to stimulation, and again prior to egg retrieval. The odds of having two negative tests is pretty low. You're probably not infected if you have two negative tests. So that's as good a reassurance as we can give you, or anesthesia, or anybody else. If you have a positive test, you probably are positive. You shouldn't come to the office. You need to talk to your primary care physician. False positives are less likely than false negatives. Do we recommend freezing eggs or embryos due to COVID-19? I think I've addressed that. That's an individual decision. If somebody asks me, do I recommend freezing eggs or embryos over doing nothing, the answer is absolutely yes. Preserving your fertility and maximizing your fertility potential is what we're about. We're here to do our best to guide you in getting pregnant. If you're uncomfortable with the present situation, whether you feel you want to wait a few months to actually be pregnant, or a few years till there's a vaccine, that's an individual decision. And but at least if you have eggs or embryos frozen, you can make that decision and feel more comfortable with that decision, that you've done something proactively to prolong your ability to have kids and preserve your fertility. I think we've addressed a lot of the questions out there. These kind of talks are always sort of interesting because it's a one-way conversation. The chat's great. The questions you people have, patients have brought up, have been terrific and appropriate. This is a conversation that really doesn't end with just this Instagram Live preview of where we are right now on May the 4th. This is a conversation that we encourage you to have ongoing during your treatment, to discuss with myself and my partners, and to have you informed, us informed. We're going to give you straight answers. You just have to realize that sometimes that answer might be we don't know. But even if it's we don't know, we're still going to do our best to help you have a nice, safe, healthy pregnancy. The last question came up about transferring. Does COVID cross the placenta? Does it affect the fetus? The only study I've seen was out of China, where they reviewed, I think, about 30 or 33 births, and there was they they had a couple of babies, a couple meaning two or three, that were in the neonatal, that were in the nursery basically, that had COVID, but they could not prove that it was transmitted maternally. They thought that the babies were probably infected after they were delivered rather than before. So the answer to that is not really known, but the initial data is somewhat reassuring in that regard. How long does the treatment for a person with polycystic ovaries? If you have polycystic ovaries, you're probably not ovulating properly, so the initial treatment is to use an ovulation drug to get ovulation to occur. That works in the cycle that we give it, as long as we monitor and make sure you're responding to the dose of medication. And the pregnancy rate with fertility drugs for polycystic ovaries is the same pregnancy rate for somebody who doesn't have polycystic ovaries trying to get pregnant, because what we've done is just restored ovulation in that cycle. In someone who doesn't ovulate, who now ovulates in a cycle, what's the chance of somebody getting pregnant in a given cycle? It says, okay, I'm going to throw away my birth control pills and I'm just going to try and get pregnant. If you're young, it's as high as 20%. If you're towards age 40, it's probably 10% per cycle. And how many cycles of treatment do you need? Most patients who don't ovulate, once you restore ovulation, pregnancy occurs in the first 3 to 6 months. If it doesn't occur after 6 successful ovulation cycles, then we have to evaluate you for other causes of infertility and treat you more aggressively. And again, with that, please talk individually with myself or my partners, so that you can get a better idea of how this relates to me individually rather than to a disease in general. And that's the case with any cause of infertility or any treatment. We try and individualize our treatments to our patients so that we can maximize them getting pregnant and have that treatment be based on evidence-based medicine, which will give us the highest potential success rate and outcome. So at this point, I'll sign off for this afternoon. If you have additional questions, please feel free to email us at the office or call us or come on in. We realize this is a crazy time for patients, and we're here to treat you. We're here to make you more comfortable. We're here to give you the best possible care in the safest possible environment. So have a good day. Stay safe, and let us know how we can help.
And